Real quick, let's plug your book because I think it's good for people to know when you're saying the manual. I know you refer to it as that, but it's the manual for the chiropractic entrepreneur. What percent, Lisa, of that book do you think applies to just healthcare in general? Like if I was a mental health therapist.
Yeah, you can replace the word chiropractic with pretty much anything else. There is
Okay.
very little in here that is honestly specific to chiropractic. I've got information in here on risk management and compliance. So any
Hmm.
healthcare provider is going to need that information. The must-dos of owning a business, projecting profit. A lot of this is like for that first year in practice. So either new graduates from any healthcare profession or someone who's been an associate and is now ready to open their
Hmm.
own. I would recommend getting going on reading this a little bit ahead of time because, like you said, there's a lot of groundwork you can lay. My background in college was as a marketing and graphic design major, and I
Hmm.
was pre-med. So I worked for 4 years at a branding advertising agency in San
Really?
Francisco.
That's
Yes.
cool.
And so that served me so well. There's a lot in here about branding, marketing, grassroots, marketing, networking, all the things you need to do to put yourself out there. And one of my big things is make your brand look like it's been there for 10 years or 20 years. Like make it so that new people moving to the area aren't like, oh, that's person's brand new. Like, oh, they're
Yeah.
established. They've been here. That's the place to go. But my weaknesses in running a business are definitely the financial piece of that, like
Hmm.
the how to calculate profit or how to set fees or how to collect money and also the accounting and the legal and the HR and the HIPAA. Like those are things I know a lot about marketing, branding, and building a fun place and a patient experience for people to come in, but I wasn't very good at the business side. And so that's the other reason that I wrote this. We do not get any of that in chiro school. So, or in optometry school or PT school or when you're getting your psychology degree, you don't. I think if they had come into the room on day one and said, "All right, you guys are all going to become psychologists after 4 years, you're going to have this great
Hmm.
practice. Oh, and by the way, you are going to have to open your own practice and run an entire business, and it's going to take all of this." Like, how many people would have said, "I'm not going to finish this program"? Like, we know maybe intuitively that the psychologist we've seen is a private practitioner, but we don't really think what that's going to mean when we're done with school. So, yes, this book is applicable for all of that, and maybe future iterations of it will say the healthcare entrepreneur or partner with
Yeah.
other professions that could dial that in a little bit more. But this was something that meant a lot to me to do for our profession, and I intentionally wanted to make sure that chiropractors knew that I was there to help and that
Yeah.
we have a lot of work to do. And so I'm really excited about it.
Awesome.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by TrustDrivenCare. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out TrustDrivenCare.com and see what's possible. Trust Driven Insights, real conversations, smarter care, stronger business.